Are you ready for another Ask Dr. Bob? Once again, a lot of tremendous questions. I'm not even sure where to start. We'll start right at number one. What do you recommend for high blood pressure? Phenomenal question. Very common challenge today. And actually I'm seeing a greater number of ladies have high blood pressure, and this is what I'm discovering. There's many reasons to have high blood pressure, but lack of magnesium. We use a product called magnesium orotate. For some reason that's easily assimilated, and it really helps individuals, especially ladies, who have heart palpitations, high blood pressure, a little bit of anxiety, respond very well with magnesium orotate. Now, I want you to know we use a product called MGzyme, which helps our female patients who are constipated. But we'll also help individuals who have had high blood pressure with vitamin D. I personally take D Forte. It's a liquid. I put 2 drops on my tongue every day. We will also help patients with aqueous magnesium. Seems like magnesium is one of the most common magnesium deficiencies. Now, you can eat magnesium with green foods. Of course, being overweight will lead to high blood pressure because your heart has to push harder against all the extra adipose tissue. Make sure you exercise. I've also seen high blood pressure with people under stress because their cortisol level causes their heart to get going, and their heart has to beat harder because of what we call the flight-fright syndrome. So high blood pressure will respond to magnesium. Do not go off any blood pressure medications unless you talk to your prescribing healthcare provider first. Dr. Bob, if tomatoes are a problem, what would you recommend as a substitute? I'm not exactly sure what you meant by what tomatoes being a problem. Now, tomatoes are nightshades. Tomatoes, potatoes, eggplant, and green pepper. They're not the issue. When it comes to the nightshades, our patients who tend to have nightshade challenges is because they have liver compromise. The liver is not functioning optimally. So a substitute to put wonderful electrolytes in your body would be cucumbers, because cucumbers are not a nightshade. They're still going to put electrolytes in your body. So it's just a thought. Tomatoes have their own texture. They're going to add electrolytes. They add a lot of different nutrients. But a cucumber, from my experience, which I also eat every day myself, will add fluids to your body. Very interesting question. I'm having a problem tolerating the flavor of beets. Do you have any substitutes? Well, in our practice, we use a product called Beta Plus, which is beet fiber, beet juice. It's in a tablet. What I would recommend that you do, I'm kind of chuckling because beets have an earthy texture, earthy flavor to them. There's really no substitute for beets per se because of the fiber, but you could use a fiber food. You could try a turnip, anything with fiber in it. You know, avocados have fiber also, but the apple, beet, and carrot. Dandelion root is also very good for liver function. Dandelion root. I personally take dandelion herb on a regular basis, 5 drops every day. My son needs tubes in the ears, they're saying. Any suggestions? From my experience, dairy and sugar, especially dairy, children should not consume dairy, in my observation. I know that the Dairy Association has everybody believing that we as human beings are lacking and dying from lack of cow's milk. It's absurd. Cow's milk is for cows. Human milk is for humans. Coconut milk would be a great substitute, but going back to the child, they could have misalignment in their neck, yogurt, peanut butter. Those are foods I would avoid. By far, sugar is an issue. So the big 2 or 3 is minimize gluten, minimize dairy, eliminate peanut butter. What do you substitute? Quinoa, rice, great alternative to wheat products. Almond butter instead of peanut butter. Coconut milk. Next question. Does Dr. Bob have any products that he recommends to someone who has osteoporosis? Anything that can rebuild bone density? First, I want you to know that stress raises cortisol, which takes calcium out of the body. Sugar takes calcium out of the body. Soda pop takes calcium out of the body. We use a calcium product, calcium citrate, calcium lactate. We have a product that we use in our practice called Osteo B2. You want to make sure you're doing protein, minimize and eliminate sugar and stress. You might have an estrogen challenge going on. I know that when ladies are low in estrogen, they tend to have a little bit more of a challenge with osteoporosis. Make sure you're exercising. I encourage you to do some kind of strength training. That would help immensely. I want to stop chewing my nails. Any suggestions? This is a very common challenge. I have found from just talking to patients coming into the office, people who lack minerals chew their nails. We've also found, having conversation with patients, is that people who chew their nails often grind their teeth. Oftentimes they eat sushi, pork, and they may have a cat. But we have found people who have cats and eat sushi and pork tend to have a challenge with parasites. People who have parasite challenges tend to chew their nails because their body is literally starving for minerals. But stress can deplete the body of minerals also. Celtic sea salt. Substitute or add Celtic sea salt to your daily regime. 1/4 of a teaspoon in a quart of water is a tremendous idea. My last question. This is a very good question. Dr. Bob, with Know Your Numbers, what is the HA1C? Well, we also call the HA1C the HA1C, and this is glucose molecules that are on a red blood cell. And see, a glucose molecule will be around on a red blood cell for about 3 months. So when we have someone do their HA1C, we're already seeing the amount of blood glucose that's been in their body the last 3 or 4 months. So when we do a fasting glucose, we only get less 24 or 48 hours. You want to make sure your HA1C is within normal, because if your HA1C is above normal, you definitely have blood sugar stress. You're going to need to lose weight. You want to eliminate sugar, 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 sugar. HA1C is very, very serious. You look at your normal reference range, and if your A1C or HA1C, which is the glucose on a red blood cell, is above normal or close to normal, it is time to get serious about eliminating the sugar that you so passionately love. Thank you for all the wonderful questions. Follow us on Facebook, tweet, add this, send this on to your friends and family. I know it'll make a huge difference. Once again, thank you, and we'll talk to you next week.